is Corina, and I'm going to talk today about the opioid overdose. Um, Opioid overdose is a big issue in the United States. It becomes an epidemic. 130 people are dying every day because the opioid overdose. Um, Currently, the government didn't do too much to stop this problem that we have. And in order to truly understand the opioid crisis, we are gonna discuss a few things today. So I made a poster here with the causes, warning signs, and prevention, the most important things we have to know about this epidemic. Um, so think about what is if this is gonna happen to one of your loved ones, like your spouse, your child, someone from your family, a good friend or a neighbor. So we have to learn and take actions against this issue that we have. As a pharmacy technician for the past 15 years, I have different patients that I prepare opioid medications or um, preventing or opioid preventing medications for them. So I learned about a lot about these problems. So one of the causes that we have, as you see here on the postboard, the doctors, they often prescribe the opioids very easily for any type of pain, which is not okay. Um, they prescribe at least a month's supply, even more than a month's supply, when probably they can treat that pain with Tylenol or ibuprofen or aspirin. Um, so in the late 1990s, the pharmaceutical companies, when they were reassuring the medical community that patients will not become addicted to opioids for if they are taking these medications for pain. So apparently this was not true. A lot of patients become addicted because they were taking these pain medications for a long time, even if they didn't need it, even if they were not even having the pain anymore. So because of that, most of them became heroin addicts. In 2015, about 92 million adults in the United States, which is like 38% of the populations, were prescribed opioids as Percocet or OxyContin. And in fact, about 80% of these patients became heroin addicts. So this is one of the big causes that we have. So the doctors, they will have to try to prescribe different type of medications for pain. Um, Another one of the opioid overdose medication that is helping is called Narcan or naloxone. And this is very effective because it's saving your life, but it's very expensive. It's like $150 if you don't have insurance. Even with insurance, it's around $30 a syringe, which is a high price. Sometimes you need prescriptions for, sometimes you don't need prescriptions for. One of the warning signs to see if one of your friends or loved ones are having this problem is you look if they have needle marks or on their arms, or if they are tired all the time, they are sleepy all the time, they are having trouble staying awake, they are visiting multiple doctors trying to shop for this type of medications. This is a big warning sign. Also, like side effects of opioids are nausea, vomiting, drastic weight loss, hallucinations. So if you see someone who is having these symptoms, then it's raising a flag and you have to watch them closely. Um, Certain type of people are more at risk than others. So this epidemic can be everywhere. Can be in your neighborhood. Can be um, Wall Street executives can have this. Lawyers, housewives, anybody can have this type of problem. Um, Prevention, in order to prevent um, this big problem that we have to train our doctors to prescribe different type of medications for pain, and also we have to ask our government and to take measures about this big problem that we have. Um, we have a Good Samaritan law that is a very good law. Um, it's not available in all the states, but this is a good law that is protecting the person who's calling to report someone who is dying of an overdose. This is very important because that's how you save someone's life. We must educate the public about the opioids. We have to, because some people they don't know what's happening, and uh, the conclusion is like opioid is at a high risk right now everywhere in the United States, and some people don't know about it. So we all have to take measures before it's too late, and do something to have a better and a healthy community.